Ons het bevoorreg om met Dr. Liza Street te gesels. Ons praat oor gehoorprobleme by kinders en hoe dit soms hulle sosiaal en ook by die skool kan affekteer op verskeie vlakke. Good morning, Liza.
Good morning. Thank you for inviting me onto your show.
It's great to have you here, Liza. Let's talk about hearing impairment with, when it comes to children. How common is this in South Africa, for instance?
So we found that there are 3 in 1,000 babies are born with hearing impairments. And if they're not identified and treated, it's school-age children, it's about 15%. So they can increase because of the multiple causes that occur during their early years.
15%, that is quite shocking. Why is it often misdiagnosed?
So most parents don't realize that their children may have a mild hearing impairment or a unilateral hearing impairment. If they seem to be talking and able to interact with their parents, they miss that there is a subtle hearing loss and they are not able to hear certain sounds or certain words are not clear. And then they end up being misdiagnosed. And only later on do we find it when they are doing badly at school or we do a screening at the school, it's detected then. A lot of the causes occur during the child's development, like infections and those things that parents don't realize have impaired their hearing.
You touched on now the different degrees of hearing loss. Can you maybe explain that? And also, do you get things that like temporary hearing loss and permanent hearing loss? Are there differences there?
So yes, the causes of hearing loss in a baby may be the prematurity or any birth complication, the low oxygen, etc. As they grow, if they haven't been vaccinated, they're at higher risk of getting a meningitis or a rubella or measles, one of those illnesses that can cause a hearing loss that is more permanent. If they have a ear infection that occurs once, you probably will treat that with some antibiotics, or if it needs surgical intervention because the hearing infections are happening 2 or 3 times in a row, then that is a temporary hearing loss that can be treated with medication and surgery. However, that untreated hearing loss caused by infections, in recurrent ear infection in the middle ear, that will result in more permanent loss and need further interventions like a hearing aid or some other intervention.
Obviously, parents and teachers alike need to know that there's an issue. They need to see something is wrong. But what are the signs that you look at? What are the things that are going to indicate to you as a teacher or a parent that your child might have hearing loss?
So the easiest thing is when they have a delayed speech development, when they're little, and they should be talking by the age of 2, and they're not speaking. And often that is the first sign where parents will go to a doctor and ask them, why is my child not hearing? And then they'll get referred on to have a hearing test, or why their child is delayed in speech. The other cause is when that is missed and they are able to speak in short sentences, the children may have difficulty with understanding instructions. And so they're interpreted by the teacher as being a child that is being disobedient and not following the instructions. And as a result, these children get into trouble more regularly at school. These children also, their marks tend to drop, and they get frustrated that they are not doing well and they lose their confidence. So these children then start to show signs that they're a bit more depressed than they were. The other problems that we find is that they exclude themselves socially because they cannot communicate as effectively with their peers. They tend to exclude and then play by themselves. So any of those kind of behaviors which are out of the norm, where your child was interacting well and now is regressing, or any regression, should really alert parents and teachers.
What would be the difference between someone having hearing loss in both ears, or even temporary hearing loss in both ears, in comparison to one ear with regards to speech development or any other development?
So often when they have a unilateral hearing loss, they do manage to accommodate and will always turn to one side and use the one ear to listen. And that is a tricky one because that's when parents don't pick it up. You know, when we offer screenings at school, parents often opt out because they say, well, my children can hear me. I speak to them and they respond. But that unilateral loss may just require a hearing aid, or it's really to find what the diagnosis is to say what you should do to intervene.
Talking about intervention now, sometimes parents lose all hope because what on earth am I going to do if my lovely child suddenly loses her hearing? The emotional impact on parents are huge as well. What do you say to parents who struggle with that? Where's the hope?
So, if you intervene early, the hope is that there will be no effect on their education and long-term development if you've acted. The problem is the parents are in denial and they try to avoid the fact that it is there and it exists. So rather than being proactive and accepting it, and obviously with counselling and with a good support system, you accept that your child has this impairment and you can then intervene early. And the research has shown that the children that have early intervention can actually end up being the same as their peers. They're not going to be delayed in their education. They can also obtain good matric results. Whereas if you're a parent who decides you're trying to avoid it because you don't want to deal with it, you then actually affecting your child's ability to be the same as their peers at a later stage. So it's rather, because we have the availability of so many resources to use hearing aids or cochlear implant, these interventions exist. So early diagnosis and treating it early have better outcomes. So I think one needs to just accept sooner and quicker and then move on, because your child will have the same joys and same matric results and everything that you would want for them.
Early intervention is important, like you've mentioned. At what age do we start these hearing screenings, and how often must I do it?
So the first hearing screening is offered at birth, when the baby is delivered, and in actual maternity wards, when the mom is waiting to be discharged. Often an audiologist will come around and offer a hearing screening to parents. That is your first opportunity to say yes, because at that point one can identify, is this a hearing loss that the baby's been born with. So if that's the case, they can immediately start intervening and you will never notice any problems with your child because of those interventions. If your baby's hearing test at birth is completely normal, we often repeat it then when they're about 3 years old, when they start going into the schooling system. It can be done earlier if you have a concern that you have been alerted to, but generally in the school system, there are many screening programs that exist. And this is very exciting, because that is an opportunity to not have to take your child out of school, go to an audiologist, get the test done. It's more expensive when you're going in a one-on-one consultation. The school screening programs are a fantastic opportunity for the audiologist to come to your child at their school. They screen all the children in the grade, and they can there and then identify if there is a concern that you should then go further for further diagnostic testing. So at least it's simple, it's cost effective, and it really doesn't even hurt the child. And these hearing screenings are often offered up through the whole of primary school.
How do you follow your child's condition when they tested at birth, and they tested 3 years later? How do you, as a parent, gauge if their hearing is dropping or if it's staying constant? I mean, is there a way to keep record of it? Because most of us, if our children get checked at school, don't get the results. They just say, he's okay.
Yeah.
And then what does that mean to you as a parent? You have no idea of what the spectrum of hearing is that your child has.
You're quite right. That is exactly why I'm so passionate about the hearing screening programs that are being done at school. It, from my own personal experience with my own children, is that the screening will be done at school, and then you'll be given a piece of paper that's a tiny little cut off and put into their bag, and it gets crumbled, and you kind of see this piece of paper, and then you chuck it away, and okay, everything was fine. But you don't actually realize that when they repeat the screening the next year, and there's a change, you never kept that piece of paper that you were given the previous year. And that has led us to, I'm actually a co-founder of a company called Ajuda, and we are digitally storing all those records for you, so that it helps you as a parent track your child's hearing screenings every year, so that when there is a change, you can see, oh, well, this is what the screening at birth was. Then 3 years later, here is your screening result at school. Where did the change happen? At least then you have something to compare to, because we're all bad at record keeping. These are pieces of paper that seem to not be important, but when your child is 8 or 9 and is having a learning difficulty, and now you are going to the occupational therapist and the educational psychologist, and you're running around to different practitioners to help you manage your child's condition, their learning disability, you have to look back and say, well, where are those hearing screenings? And often as a pediatrician, when a new child comes to me and I have no reference, I send them for all of their screenings from the beginning if they haven't been able to give me those results up front.
Very important to keep record of your child's tests. Thank you so much, Lisa, for chatting to us this morning and for indicating the need that there is, so we know how to approach it. Thank you very much. Dis Dr. Liza Street, wat met ons gesels het oor jou kinders se gehoor. Dis altyd belangrik om rekord te hou op 'n lang termyn van hoe hulle vorder en hoe die gesondheid van hulle gehoor is. Nou ja,